Hi, Dawn.
Hey, we did
Hey.
it.
Yeah. How are you?
I'm good. How are you doing?
Yeah, I'm good. My baby's sleeping, so it's the perfect time.
Hopefully the whole time.
Yeah, when they sleep, it's like, wow, so happy.
Yay.
Okay. Eh, hang on, let me just cover the window.
Yeah, yeah. Hello, everyone. Hey, Tess. So good to see you. Hello, guys. Hi.
Hi, everyone. Today's
Yeah.
National Day.
Yes.
Yeah, we are a young country, 56 years old now.
Wow. Amazing. I'm
Yeah.
going to get out there sometime soon. As soon as COVID gets
Yeah.
better, please get better, COVID.
Yeah, I
Then
know, right?
I'll be traveling out your way.
Yes, please come. You've got lots of fans here.
Oh, thank you. Thank you so much. I'm so glad to be here. Thank you so much for having me.
Okay, so I think maybe we can start first. I'll just give a quick introduction. So, hi everyone. Thanks for joining us today. I'm Angeline from Savvy Mama SG, and we are very lucky to have Dawn with us today. So, for those of you who do not know, Dawn is the inventor and designer of the Easy Peasy Tiny Spoon, the Tiny Cup, the Mini Utensils, as well
Yes.
as the Mini Cup.
Yeah.
Yeah, so Dawn is also a pediatric speech and language pathologist and feeding specialist. So today we'll be sharing some of the key features of the Easy Peasy range, as well as answer some of the questions that you may have on the Easy Peasy products and baby-led weaning along the way. So just drop us questions along the way and we'll try to answer them. And also stay with us to the end because we are giving away to one lucky winner a first food set.
Yay.
Comes with a tiny cup, tiny bowl, tiny spoons, a mini feeding set, which has the mini
Oh,
mat, the fork
yes.
and spoon, as well as the mini cup straw training system. This one is always sold out
Yeah.
because it's just so good.
Thank you.
So yeah, I love it. And the full
Oh,
Easy Peasy range is also on sale at 50% off on savvymamasg.com
oh,
until this
wow.
Saturday.
Go get it, guys. Go get it.
Yeah.
Wow.
Even the sets too. So I mean, it's quite rare to have such a sale. Yeah.
Wow.
So
Oh
yeah,
my goodness.
we are
Wow.
really,
So, yeah,
really
look at all those hearts. Wow, that is like unheard of, y'all. And
yeah.
for those of you who are in the United States and you just saw that beautiful pink color, that's just for overseas. So for those of you who are in Singapore or overseas, that color is only available to you guys. It's not here in the United States. So all the US people that are on, that color is not available to us.
This
But the
one
blush
blush,
is the
blush
mini
is
feeding set, that beautiful pink is just
ah
available for overseas. Yeah, it's such a
okay.
great color.
Yeah, it's a great sale. Okay, so I think over to you, Dawn, to share
Yeah.
the Easy Peasy range.
Thank you. Yes, I'm happy to. And feel free to type up any of your questions. I see your questions here, and I can answer them along the way as well. Yes, crazy ginger mom is saying that's such a bummer. I love the berry color. Me too, me too. But it's a specialty for our overseas families. So and I'll just go through some of the range and talk to you guys about some of the benefits, and then answer any questions that you do have. And if you want to, if I miss a question, feel free to just say, hey, Dawn, you missed this. And then just talk about developmentally why this is such an important product and an important line, and why we are really superior in the field with
Mm.
babies and toddlers. And not to throw any other brands under the bus at all, but just to kind of tell you from a developmental and safety perspective what makes us different.
Mm.
So we'll start with the tiny line, since we start with the infants first. And I love all the hearts. Thank you so much, you guys. I see all those. Let's start with the tiny cup. So the beautiful thing about the tiny cup is that I designed it to be angled on the inside. And most people don't really understand what that means. What that means is basically that the liquid is going to come out, so your baby never has to tilt their head back. When babies tilt their head back, they open their airway. If you take a CPR course and they basically say, turn your baby upside down, right? It's to open their airway, or to tilt the head back is to open the airway. So every time we tilt our baby's head back, or if they teach tilt their head back, it's opening up the airway, and we don't want. So if you're drinking from a sippy cup, for example, you're opening up your airway, so that liquid can go down into the lungs. It can go down into the ear, the eustachian tubes, causing ear infections and hearing loss. I have my minor in audiology, and we'd see these babies that were completely normal hearing, and then we're sucking on a sippy cup, and then all that liquid goes into their ears and causes ear damage. So it's really important to have an open cup to be able to facilitate that really good head positioning, so the babies never have to open their airway. So it's cone shape on the inside, so that that liquid just comes out, so your baby can keep it nice and tucked. So that's what's so important. And how you're going to introduce this cup, you can start to introduce, oh, my fake baby needs her hair brushed, is you want to do this around 6 months of age. You can start it at 4 months as well, but 6 months is really the good point. And you're going to put breast milk or formula. We do not put water in the cup for babies. Most medical professionals say no water for babies before 12 months of age. And the reason why is that it can cause kidney damage to your babies. It can cause a whole bunch of other medical issues for your babies. But as a speech pathologist and swallowing expert, it's because that water is so thin, it goes down the throat very quickly, causing gagging and choking, and having that liquids go into the lungs. So you want to only put breast milk or formula into your baby's cup until around 10 months of age. That 10-month mark is a really good mark where now they've got good tongue elevation, good tongue lateralization, they can protect their airway a little bit more. Then you can start adding in a little bit of water. But most medical professionals say no water before babies till 12 months. I start a little bit earlier, like 10 months of age, just because we want toddlers to actually enjoy water, right? But we kind of have to introduce it just a little bit earlier than that. So I start to introduce water.
Soup broth? Is it okay to put soup broth? Like soup?
Yes, you can put soup broth in there because that's still a little bit thicker. So you can put puree, soup broth, breast milk, formula, yogurt. You can do some of the allergens into the tiny cup. So you can thin out a little bit of yogurt, thin out a little bit of peanut butter, to, offer a variety of liquids. But water is a thin liquid and it goes down the throat really, really fast. So we're going to put breast milk, formula, applesauce in the cup, and you're going to hold it. We're not going to put it up to the baby's face. You're going to hold it and have your baby's going to be so curious. So have your baby come towards the cup, and then you're going to kind of take a sip and put it down. You are completely in control of this cup. Most parents are like, oh my gosh, if I introduce an open cup to my baby, it's going to be so messy. Nope, you're holding it. So the developmental milestone is at 6 months of age, a baby should drink from an open cup held by an adult, not independently. We are holding it. So you're going to practice this 5 minutes a day with a little bit of breast milk or formula or a puree. And you're going to offer that, take nice couple sips, because the next developmental milestone is by 12 months of age, your baby is supposed to hold onto this cup and drink independently with spillage. Now, they'll never make that mark if we haven't practiced before, right? So we're going to practice with this, and it's weighted. The tiny cup is weighted, so it makes it easier for babies to actually learn how to hold. And it's cone shaped, so it's going to keep them in that safe position. And so we call it topple resistant because it's weighted on the bottom with sensory bumps here. That's going to have your babies hold on to the bottom of the cup to be able to learn how to drink. So once you start practicing, then you can start, your baby's going to want to hold on to it and start to try to drink on their own.
My
and
baby
depending
does
upon,
this.
yeah.
Yeah, but of course some liquids come out. But
yes.
it's learning.
Yes, and that's so important, right? Because and again, we're not expecting that skill to happen till 12 months of age. But here's the thing. We designed it so good that I have 6-month-olds that are like, oh, let me got this. I totally get it, right? So that's early, and we're like, yay.
Yeah,
and
because it's non-slip.
Yes,
So
yes.
It's very intuitive for her to grab.
Yes, thank you. And so these milestones can be made earlier. Some babies will get it, and I have other moms that are like, oh my gosh, my baby's almost a year old and she's still not doing it. It's like, that's okay. Just practice 2 times a day. So the more that we practice, the better it is. But I always tell the parents, especially when you're kind of overwhelmed with starting solids and you're just like, oh my God, my whole world has just turned upside down. Just 5 minutes a day is good. But here is an expert tip for you. Some so-called experts say, do not give your baby breast milk or formula during the meal. And I say something different. We want to have this cup ready with some breast milk or formula, maybe not on the tray with your baby because of spillage, but you want to have that, because if your baby starts gagging, just like if we were going to start gagging or we start choking, what do? We'll take a drink of water to try to swallow that down. If you don't have this ready with breast milk or formula, then you have to get up, leave your baby who's having some gagging or choking, run over, get some breast milk or formula, and come back. It's too late. So we want to be able to have that just available. And again, this is a 2-ounce cup. You just fill it up with a 1/2 ounce to 1 ounce, something small, just so your baby could have a sip. And it does 2 things. One, oh, I love all these hearts. Your community is so involved right now. I love this. It does 2 things. One is that it helps them to be able to have a liquid to, like, if there's something stuck in their throat that can help push it down. The other thing is it works on lip closure. Lip closure is having the lips go over and close over the tiny cup. If everybody just pretends right now like you're gagging, like in choking, like, what's the first thing you're going to do?
Swallow.
Try to close your lips and swallow. Babies will keep their mouth open if they haven't practiced drinking from an open cup.
Oh.
In fact, if they've been on a sippy cup, what they'll try to do is go. And that's what we don't want to do, because what that's going to do is help move that food up and down. We want that food to go down. So if you're practicing with the open cup, skip the sippy cup, just throw that out and practice with the open cup, because it's going to help to be able to decrease choking. And I see here,
how old can my baby start using it?
Yes.
4 to 6 months, right?
Yes. The first food set that we showed you earlier, this is a great baby shower gift because it has the tiny cup, tiny bowl, and tiny spoons. So here's the thing. You can start having your baby play with the tiny cup empty. Nothing in here. Oh, I'll talk about a straw in just a moment.
Yeah, the straw.
Good questions, you guys. You can have your baby mouth this without anything in it. So you can start doing that at 3 months of age, right?
Yeah.
The other milestone is babies are supposed to be able to grab onto an object and start mouthing it. So if you give your baby the tiny cup, so you buy the tiny collection from, especially with 50% off right now, you better head over to our website and just get that. And then you can just have your baby start to mouth this, kind of like a teether. And then when you actually start solids, your baby's like, oh yeah, I know what this tiny cup is. It goes right to my mouth. And once you start pouring breast milk or formula, they get it. So it makes it really easy.
I can attest to that. I did it at about 4.5 months, and then when I started putting liquids in it, after the first maybe 2 or 3 tries, she could do this. I mean, she just grabbed it and then she just tried to.
Yay!
Yeah, but a little bit messy, but it's improving.
That's so great. And that's, that's to be expected, right? This is all going to be a messy process at the beginning. But here's the thing. You'll see, it's better to have mess with a cup at 6 months of age than have a toddler with tons of mess, right? So we put in the work now in order to be able to have our toddlers by 12 months of age. They're supposed to be drinking from an open cup independently. If they've been practicing a little bit, it's not going to be as much spillage, because then the ounces start to go higher and higher. Right now, your baby is only supposed to have 1, maybe 2 ounces total, right? When they're a toddler, we're talking about 4 ounces, 8 ounces, right? That's a lot of spillage, right? So we want to be able, you can fill this up with only 1/2 ounce, especially when we're dealing with breast milk. That's liquid gold. So just fill it up with 1/2 ounce and have those couple sips and have them practice. So when they get to the toddler age, they're not spilling, an entire thing of milk. So if we do it early, it's worth it. Any questions about the cup? I'll start moving on to the spoons here. Let's see any.
Yeah.
Okay.
The cup, I think, is related to the straw question.
Okay, yeah, I'll go to the straw after I finish the tiny line. Perfect. Okay. So the tiny spoons, this is, yes, and I love that we have 2 different colors here. It is so important to make sure that you have a baby-led spoon. And I see this question too. I know it's okay to introduce straw cup and open cup at the same time. Yes, it is, but we're going to talk about when you're doing it and why you're doing it. So that's coming up next. So the important thing with the tiny spoon, this is the Ezpz Tiny Spoon. It has sensory bumps here and it has a short, fat, round handle. The research shows that we should have a short, fat, round handle for babies to hold on in order to feed themselves. To give you a difference, here's another baby spoon, right? This is, so you can see the difference. This is an adult lead spoon. This is a baby lead spoon. So when we feed babies with an adult lead spoon, a really long handle and a huge spoon bowl, it increases the likelihood your baby's going to choke, because anything that goes into a baby's mouth, if we put it in a baby's mouth, can cause choking. So the most issues that I've seen with choking in my private practice, and I'm a feeding therapist, I work with hundreds of babies every single week. This is the key. When we put food into the mouth, we don't know how far you're going to put that in. So if I was going to put a spoonful of food in your mouth, you don't know how much I'm going to put in, how far I'm going to go back, how much pressure I'm going to put on the tongue. So what we end up doing is we breathe in. And that food goes right down. So most of the choking cases that I've had in my experience have been with purees, not with solid foods, strips of food, because we're trying to shove it in. So with a developmentally appropriate spoon, like the tiny spoon, babies developmentally are supposed to put a spoon into their mouth independently. So why are we doing this for them? We don't need to, right? We're actually delaying their development. So if babies don't actually use a spoon, then they have delays in coloring and scribbling and writing and literacy, because they haven't had a lot of experience using their fine motor skills. So what we're going to do is, this is a tiny spoon. I'm going to introduce you to the tiny bowl. So what we're going to do is we're going to take that spoon. Oh, you have the pretty sage color. I love it. So we're going to take that tiny spoon. We're going to scoop up the food. If it's a puree, let's say it's yogurt, we're going to scoop up yogurt. And then we're going to do one of three things. We're going to either place that on the rim. So all baby has to do is grab that and stick it into their mouth, because they're going to be super curious about it. Or we can take that scoop and we can put it on the side of the mat so your baby can grab it really easily. Or we scoop and we just hand it to baby. I'm not feeding baby, I'm handing it to baby. So what that looks like is I just preloaded that spoon. I preloaded that spoon into the bowl, and now I'm handing it to baby. So baby's going to grab a hold of that spoon and put it right into their mouth. We're not touching it. She's working on that skill. She's working on hand and mouth coordination. She's working on fine motor skills. She's working on oral motor skills. She's working on all the sensory skills. She's smelling it. She's tasting it. She's feeling it. She's looking at it. She's hearing the food go into her mouth. Boom! It's so huge, right? Oh, I see this. Wow, thanks for the idea. Good, I'm so glad. Because they can do it. And if we feed them, then we're just not letting them learn. We're not giving them the opportunity. And then we're increasing choking risk too. So we want to let them feed themselves. So the benefits of the tiny spoon is that we have these sensory bumps here, right? And what that's good for is when the baby is putting the spoon into their mouth, these bumps are going to trigger a response like, hey, you're going too far in. So if they go in, they're going to kind of gag themselves, right? And so this is going to give them that sensory feedback. There's a lot of spoons out there that have like a choking guard or choking barrier that has this hard plastic piece that goes around. And what that does is it doesn't allow a child to learn how to be able to put the food into their mouth. So when they move onto a fork in toddlerhood, they stab themselves. And then they really hurt themselves with the fork. We need to let them do this. So we said, my son is 3 and weaning him is so difficult. Yes. Yes. So we want to wait until 6 months of age to actually start solids. So if it's possible to wait, it's really important to do that. The American Academy of Pediatrics and the World Health Organization encourages parents to wait till 6 months of age, because the earlier that you start solids, and it is really difficult, the earlier you start solids, the more increase of choking risk. So we want to wait to that 6 month mark. And if your baby was premature by 3 weeks, and you wait 6 months and 3 weeks. If your baby was premature by 4 weeks, you wait 6 months and 4 weeks. I promise you it's worth the wait, because it's so much easier feeding a baby that's excited and developmentally can do it than they're just sitting there like, I don't even know what I'm supposed to be doing here.
I just wanted to share like on the spoon, right? Because initially you said to put here and on the mat, but I don't know, sometimes most of the times what I do is I just offer the spoon like this in an angle that, because she always grabs the spoon this way and puts it in her mouth. So I haven't tried on the mat, but you know, some of the foods they they drop before they it gets
Yep.
into the mouth. So any tips for that? Like
Yeah.
just move like
So I like to start. Is my mic okay? Can you hear me okay?
yeah, it's
Okay, great,
perfect.
great. Um, so I like to start off with at the beginning of the meal, right? When you're starting off, if you're just starting off right now and your baby's 6 months and you're like, great, this is a perfect IG live because I'm starting today. You're going to start off with a couple of purees. And the reason why you're going to do that, even though I'm teaching baby-led weaning and this is what we want is a baby-led approach, you want to assess your baby's swallow. Every single time a baby comes to me and I have to assess their swallow first. I have to make sure that they can do it safely before I give them a chicken leg, right? We have to make sure baby is able to swallow safely. So we want to offer a couple of purees to be able to do that. And usually that takes about a week to just make sure, because they don't eat very much, right? You offer this whole food and they like eat like that much. So how do you really know if they can swallow safely? So during that time, you're having some thinner purees and you're going to offer that to baby, and then some of it's going to slide off. But then towards the end of that 6-month mark, when you're offering a couple of different foods at the same time after you started really slowly, you can offer a puree and then give that to your baby, and then you can squish like a blueberry or a piece of banana, and you squish it onto the sensory bump so it stays on there, and then you can offer it to your baby too. So you can kind of go in between purees and solids. Or if you're, let's say you cut up a whole bunch of strawberries and pieces of strawberry comes flying out. Well, that's, we don't want to waste food, right? So we could take a little bit of that strawberry and we could squish that back onto the spoon and offer that back to baby. So then you can kind of go back and forth between the textures. What about thin, watery foods like soup, whites, porridge?
Put them in the cup.
Exactly. You
That's
knew
what
what I
I
was going to
do.
say.
Yeah.
Yep. You could put it into the cup and let your baby work on that. You can put it onto the spoon. It's hard when especially if it's super thin. Yeah. So we want that to be a little bit thicker. Remember when I was talking about no water for babies? Because we don't want a thin liquid. So you can just make that a little thicker by offering just a little bit more breast milk or formula and kind of thicken that up a little bit. Porridge is great because it's a little bit thickier and sometimes it's chunkier, and we want to offer baby a variety of textures, which is so important. But putting it into the cup makes it really easy. I also want to mention that when I was talking about lip closure with the cup, we're still working on lip closure with the spoon too, right? We're really working on that too. So you're still working on lip closure when you're using a spoon, which is really important, because if some parents say, well, I'm giving my baby solid, so strips of food, so isn't that working on lip closure? But it's not. If we're taking a piece of asparagus and putting that in there, your baby's trying to munch, right? Even though they don't have teeth, right? You want that food to be really soft, so baby's kind of munching it with their gums. They have their mouth open. They're not actually working on lip closure. So we need to be able to work on lip closure with the spoon, still have some pieces of food, working on lip closure with a cup. And so we want to continue to do all of those exercises and all those motor movements in order for your baby to learn how to do that safely. So we want to do a baby-led spoon as compared to a long-handled spoon, very important, and offer that to baby. And then lastly, with that tiny bowl, you want something that suctions to the table or suctions to the tray. Now, we get asked a lot, I'll just put food onto the high chair tray. And here's the deal with that. One, that baby is going to start to do this. I call it the windshield wiper motion. And they're going to do this, and they're going to see food fly off the tray, and it's going to be so much fun. And you're going to be like, Dawn, it's so messy, because you don't have a plate or a bowl. So if that bowl or plate's here and the food's there, your baby wants to explore the food. So they're going to go for that, and they're going to actually use their whole hand grasp. I designed this to be high enough to actually work on that grasp, right? So they'll put that into their mouth, whereas on the tray, it's so slippery. So even if you are feeding your baby in a high chair tray and not at the table, you want to have this bowl. It's going to suction to that, and it's going to make it easy for your baby to get food off, because when they're trying to get food off after the tray, what do they have to do? They have to slide that food, right? And then they have to come to the ridge of that tray. So let's see what that looks like. So sliding right to the tray, what are they doing? They're having to lean back to grab that piece of food, then they're putting the food in the mouth. Look where we're at again. the airway's open, increased
Yeah.
risk of choking. We don't want that. We want a plate or a bowl right in front of us, just like you and I eat, in order for the baby to decrease choking risk. And you can't do that if you don't have a bowl. So it's really important to be able to, again, decrease choking, right? So those are some of the reasons that it's important. And we want babies to work on that whole hand grasp. We want them to develop that as well as developing from a spoon. So that's why we can kind of go from, maybe you put some spears of strawberry here and a little bit of yogurt on this side, or spears of strawberries here and a little bit of yogurt on the side, so that we can kind of work on all of these skills at the same time.
Right.
My baby likes to grab a lot of snacks in her hand and put it all in her mouth. Oh, great. Okay. So what we're going to do with that is if we're offering one food, let's say you want to use a plate. So you can put, I'm going to keep using strawberries as an example. One spear of strawberry here, one spear of strawberry here, one spear of strawberry here. Now we can't overstuff, right? If she grabs that food, right, and it's just one slice. Now you will have to kind of like put different pieces, right? But babies will overstuff and grab a whole handful for two reasons. Number one, we're serving it with everything is all together. Or number two, they haven't developed that munch chew. So that can mean that maybe we are cutting those slices too big. So the food slices should be about the length and thickness of a pinky finger. I see on Instagram all the time these huge chunks of food, and what that does is it covers the gum line and the tongue. What is baby going to do? Have to overstuff in order to feel that. So we want that piece of food to just go onto the gum line, right here, not on the tongue, because that'll increase choking and do overstuffing. So we want that to just be skinny, like a French fry, not bigger than a French fry, and go here. So baby can keep that motion going, right? So what we can do,
like balls, like meatballs.
Yeah, so I don't do meatballs because of that same thing. What are they going to do? Shove the whole meatball into their mouth. And then we have overstuffing again.
So even things like strawberries, you should cut like.
Yeah, exactly. And meatballs you can flatten. So when I make meatballs for baby led weaning, if you're making them, you can you can make them circular, and then you squish them down to patties, and then I just cut them into a strip.
Okay.
So then that makes it easier to do that, right? So those are just some suggestions. Again, oh, you're so welcome. She says, I like you sharing so much. You're so welcome. And here's the thing, if baby is struggling and doing these things, I always try to see, what can we do as adults? What can we do to see, maybe we can help baby go this way? So it's never anything like, you're doing something wrong. It's like, let's try this, right? Because baby's just like, hey, mom, give it to me. Show me how to do it, right?
Yeah.
So the problem with overstuffing is that it can lead to choking. So what you want to do after every single meal is you want to look inside of the mouth. So you want to look in the cheeks. You want to look underneath the lip. You want to go and flip this lip too, see if there's any food in there. And then at the roof of your mouth, right there. Because sometimes food can hide in all those pockets. So remember we were talking about the tiny cup at the beginning? If you have cold breast milk or formula and your baby's overstuffing, take a quick sip. Exactly. Because then all of a sudden baby's like, ooh, this cold breast milk is, in my mouth, and it brings sensation to the mouth. Kind of like when you brush your teeth in the morning, like that nice sensation. Babies need to have that too. And then they're just like, oh, I think I have something stuck over here. Or they're like, my mouth feels so good, I can feel the food, so I don't have to overstuff. So there's some tips with that too.
Okay.
Oh, lots of hearts. I love your community. This is great. So that's the tiny line with babies, and why you want to kind of skip the sippy cups, and why you want to skip long-handled spoons, and why you definitely want to use a bowl or a plate. Oh, the other thing is, as your baby grows, I always say around 10 months of age, that baby, if you haven't been using a bowl or a plate and you've been eating off of a high chair tray, they're going to want to get out of the high chair because they see you eating from a plate. They're like, what's in mommy's plate? Let me try to get out of the high chair. And those are the babies that I see that fall out of the high chair and get head injuries because they want to know what's on mom's plate. They want to see what's in dad's bowl. But if they have their own bowl and plate and they see that everybody is having some of those same foods, they're not trying to get out of their high chair. So that's another safety feature with that too. Any other questions regarding the tiny bowl, tiny spoon, tiny line? Well, she's got a 50% off sale, so make
No,
sure you head
15,
over there.
15, 15.
15% off.
15.
Oh,
Yeah.
15. Perfect. That's so great.
Yeah.
Okay, so let's move on to the mini. Let's move on to the mini line. Okay,
Yeah.
the mini
I
mat.
I love the mini mat.
Oh, thank
Yeah.
you.
It's just so like it's a happy face. And then it kind of reminds me to put like, like a vegetable, a fruit, and maybe some carbs. And it just so good to use, and it just makes every meal look happy.
Yes, it does.
Yeah.
And it's so cute. It's so
Yeah,
cute.
it's
It
so
makes it
cute.
so fun to be able to use and really functional too. So the design aspects here is this smiley face, you guys. If you use just a regular plate, like another brand plate, what's really important is that that's not developmentally appropriate, right? If we're using a plate that's really hard for babies to use, this edge flips down. So if baby is using their whole hand grasp and they're grabbing it, see how this ridge moves down? So it makes it to be successful every time they grab.
Ah, I see. Okay.
So this is flexible, whereas these eyes are not flexible. See, that's solid. This is flexible, so developmentally, babies can grab with their whole hand and bend this back, see that, and grab the food.
Right.
So it's so important from a developmental perspective. And of course, the spoons fit in here too. So you can, again, have, some puree in here and finger foods in here for your baby. So yes, and what you're saying, this is really important too. We want to offer a fruit or a vegetable, a protein, and a carbohydrate in at every single meal. So it's a nice, like you said, visual reminder. So it just reminds you, we want the carbohydrates is what helps babies grow. So we need that to be in the bigger section of the mat, a protein and a fruit or a vegetable. And this is great because this offers a great reminder. And it's nice to be able to say, oh yeah, what was I supposed to serve here? Or if grandma or, a nanny comes over, then you can be like, hey, this is what goes in each section. So then they can help you too.
Yeah.
So thoughtfully designed. Oh, yes,
Yeah.
thank you.
Baby is trying to hold and throw away the plate or bowl.
Okay, so as frustrating as that sounds, it's developmentally appropriate. So as frustrating as that is, it is important for babies to learn this cause and effect. So it's basically, if I drop this plate, if I pick up that plate off of there and I drop this plate, what's going to happen, right? Usually babies don't just like throw things. They'll throw and be like, oh. And that is a developmental skill. And what is really great about that, even though it's very frustrating for us, is that is around the time that your baby's hunger is going to increase. Okay. So they really understand their hunger and fullness cues, because one of the reasons why babies will throw plates is because they're not hungry. So we have to say, if we see that a baby is throwing their plates or bowl, we're like, you know what? Maybe instead of feeding her at 11 o'clock, maybe I'll feed her at 11:30 so that she'll be a little bit more hungry. So that could be something. Another strategy you can do is put her favorite foods on the outside of the mat. So if her favorite foods are on the outside of the mat, she's going to be less likely to toss it, right? So you can put some of that onto the side of the mat. And then third thing that you can do to help decrease throwing is eat with your baby. So if your baby's here in the high chair, I'm going to be sitting here and maybe I'm eating off of a plate and I'm making all kinds of great sounds like, strawberry is so good. Oh, right? Exactly.
Yes.
And then they're like, what? And what your baby might do, instead of throwing the plate, what your baby might do is give you a bite and take the bite. Eat it. Because here's the thing. A lot of babies will start to feed you, and I've had so many babies feed me. A lot of babies start to feed you, and then they'll go,
oh!
And then it's just like they just want your attention, right? It still wants to play. So instead of playing the throw the food off of the tray and you clean it up and having to make a whole nother meal, it's, hey, I'll give a bite to mommy, I'll give a bite to me. I'll give a bite to mommy, I'll give a bite to me. And now we're sitting at the table longer. We're trying new foods. We're learning how you're chewing. Then I'm going to practice chewing. We're having a relationship instead of like, you threw it again. Now I have to make something else, right?
Yeah.
We're able to kind of build that trust. And it's so important for babies to know that we're going to eat those foods too. Now, I get asked all the time, like, well, I'm serving my baby sweet potato and I don't like sweet potato. And it's like, you don't have to eat the whole sweet potato, right? You just need to take a bite. Right?
Yeah.
So I'm not going to say, eat the whole spear, just
Yeah.
take a bite and then your baby will start to do
Mm.
that too.
Sometimes
So
I
that's,
just take from the the plate inside when I eat, and then she will start eating it because sometimes she
yes,
just doesn't want, but when she sees me eating it, she wants it too. So
yes.
I guess that's something that we can try too.
And that's so important because if you think about it, it's like, we do the same thing as adults, right? So if I
Mm.
came over to your house and you're making some dish I've never seen before,
Mm.
right? And I don't want to be rude. I want to eat it, right? I'm very curious, but I'm like, do you pick it up? Do you use a spoon? Do you use your fingers? Do you use like, I don't know.
Yeah.
I'm going to wait and I'm going to
Mm.
see what you do so that you can model how to eat that food and then
Mm.
I'll eat. So
Yeah.
babies sometimes, even if the food is a food that they've eaten before, research shows it takes 15 to 20 times, sometimes 10 to 15, but a lot of times for a baby to actually know not only that they'll be willing to try that food, but know how to eat that food, even
Mm.
if we've offered it over and over again. So,
Right.
and we have to remember too, friends, is that mouth, that face, everything is changing. Your baby who ate avocado very willingly at 6 months of age, now at 8 months of age has a couple of teeth and they're just like, I don't know how to do this again. That mouth
Right.
is moving and changing. The tongue is getting bigger. The teeth are erupting. Like that avocado may be totally unfamiliar to them because now it feels different in their mouth. So
I
they're
see.
just like, what? And you might see them like take a bite and then they're like, what?
Yeah.
And you're
Tasty.
just like, you love avocado. You've eaten it 100 times. But
Yeah.
now that mouth is different. These taste buds are changing, right? So all of a sudden, it's just like this whole new food to them. So they might need you, exactly what you're saying, to, you need to take a bite. And they're just
Yeah.
like, oh, yeah, I remember how to eat avocado. I got this. So
Yeah.
it's just being able to model that. So um, does
Somebody
easy peasy,
asked,
oh, go
yeah,
ahead.
the easy peasy stick on the big BLW tray. Yeah, I'm using the big tray also. So it is not exactly, it's a little bit textured, so it doesn't stick as well.
As well.
So what I do is, like, if I see that baby's gonna like move it, I hold it down. So there's no way that you can fly it down. So but it just means that you have to watch your baby. But you have to watch your baby when she's eating anyway. So
Right.
what I do is I just hold it down and she knows that I can't move this. So
Yep.
she stops moving it or flipping it, or so far
Perfect.
I haven't have it flipped off the tray yet. Yeah, but touch wood.
Yeah.
I hope I just hold it down, then they know that they can't move it.
Yeah, absolutely. And here's the thing with that too, and why that's so important is that some people, if it doesn't suction to the high chair tray like super well, just think that if you're using a plastic plate, for example, because that's like the alternative, is that that's going to slide all across the high chair tray. So even if it doesn't suction as well, the developmental benefits is so important because as if you use a plastic bowl or plate, as that slides across the tray, remember how I said that we don't want the head back when they're eating, but we don't want the head side to side either. Because here's the thing, we want the head to be tucked down to be able to eat like this. As soon as that bowl or plate moves and the baby moves, now I can increase choking risk. My throat is not straight. It's to the side. So we don't want that. We want baby's head forward. So as they kind of move that plate, which is the other alternative, we're sliding that across. And then also the American Academy of Pediatrics and the World Health Organization don't recommend plastics for babies. So there's other reasons to be able to kind of consider food grade silicone and want to get it from a reputable company. There's a lot of like knockoffs that are out there and they're not food grade silicone. So, and that's unsafe for our babies too. So we just kind of have to make sure that, we really, make sure that that's important for us if you want the safety features there.
I think two persons asked about the point that you mentioned, 15
Yeah,
to
about
20
the research.
times of the same food and the research, you know. Perhaps we can share it after this, like on the IGS.
Yeah. Yeah, you just DM me and I can tell you the research. So the research says a baby or a child 10 to 15 times needs to be offered that food in order for them to actually accept it, right? When they are young, 6 to 8 months of age, they'll just grab anything because they're really interested and curious. But here's the thing. As a feeding specialist, the thing when I have really extreme picky eaters, those are the babies that were not given a variety of foods. They were not given a variety of textures. And so they tend to be extremely picky. In fact, I'm doing a workshop, a free workshop this coming week called What Do I Feed My Baby After Avocado, Banana, and Sweet Potato? It's myself and nutritionist. Her name is Katie Ferraro. And we teach this class together and we talk about what do I feed my baby after avocado, banana, and sweet potato? Like what's next? Like usually we get those three. So I'm doing a free workshop. You can look in my Instagram feed. Yeah. Oh, thank you. Thank you. And so you can click on that and we'd be happy to have you. But we talk about that research in that workshop because most of the babies that I see that are at, yes, Tabasco Lover just put that link on there. So thank you so much.
Thank you.
go.missdonnaslp.com/BLW workshop. Thank you.
Thank you.
So why that's so important is that traditional purees, those babies can maybe have 10 to 15 different foods by the time they make their year birthday. The program that we teach, the babies have 100 foods by their first birthday. And why that's so important is that then they're going into toddlerhood with all these different tastes and textures and temperatures. And we know that research says children need to see that over and over again before they really accept it. And they need to see it for you eating it as well, which is why it's so important. So yeah, that's great. You are so welcome.
And the 100 foods is really to make sure that we know that baby is not allergic to anything, right?
Right, absolutely. We know that those allergenic foods, if we give those to babies early and often in whole food form, that's so important. There's other companies out there that will put like powders and stuff in like bottles. And the reason why I don't use any of those products is because, again, developmentally, babies are supposed to eat these foods. Babies can eat yogurt. You don't need to have a powder to put into their bottle. Babies can eat yogurt. Babies can eat crab. You don't have to put powder in a bottle. And in my experience, a lot of the parents that actually use those powders and put into the bottles, babies stop drinking their bottles. Babies need to be able, that's their primary nutrition is breast milk or formula. They have to have that or else we're going to have some serious medical issues. So we never want to put anything into a baby's bottle or into that breast milk when your baby can absolutely have those whole foods in whole food form. We just need to make it safe. Like, right, I'm not going to give them a big hard piece of crab. We're going to shred that, make sure that crab is really soft before we offer that. We're going to offer fish. Fish is an allergenic food. We're going to make sure that it's a really fatty fish like sardines, and we're going to cut it into an appropriate size so babies can actually eat that. So it's so important to do that. And this kind of brings us into a great segue of talking about the straw cup, because you can actually put allergenic foods in an open cup. You can also put in the straw cup. So all the developmental, yes, thank you. All the developmental benefits and all of the system is on the back of the packaging. So on the back, I'm going to tell you all these things, but here's all the call outs to that. And here's the 3 steps of why we want to do it this way. So everything that I'm going to tell you, because straw drinking is a lot more complex than open cup drinking, all the information is on here on the back. So when you buy that from that 15% off code, you're going to be able to get all this information. So don't throw the packaging away. Like, keep this here so it'll make it easier for you to remember. So here is the developmental milestone for open cup, right? 6 months of age, babies are supposed to drink from an open cup held by an adult. Straw cup, we want to offer the straw cup around 9 months of age, because when we offer straw drinking a little bit earlier, it can cause that liquid to go down the wrong way. So here's the thing. When you think about drinking, everybody just do this at home. Pretend like you're sucking from a straw, right? You're sucking and you're holding your breath. Babies at 6 months of age have a hard time holding their breath. They haven't really experienced that. We need to focus on lip closure from a muscle standpoint before we work on lip rounding. So we have to establish this muscle before we establish this muscle. So it's very important for babies to work on open cup drinking, 6 months, 7 months, 8 months, 9 months. And then we introduce a straw cup. And that's a variety of different things. We're trying with the open cup to work on that lip closure to help protect baby's airway from choking. Now we're going to start with the straw cup. And here is the disadvantage of most straw cups that are out there. So if I take apart a very popular straw cup, and we look at the straw that's on this one, I'm going to take that out, and we bring these together. You can see the mini cup straw is really, really short, and this is super long. Baby has to hold their breath the whole way up. That is a long time. So babies can't hold their breath that long. So what happens is that then they take a breath, and then that liquid goes whoop, right down into their lungs. And they're like, I don't know why my baby keeps coughing. I don't know why my baby has pneumonia again or bronchitis again. It's because that straw is too long, or we've offered the straw cup too early. So when I designed the mini cup and straw training system, I wanted to have, from a safety feature, a short straw. The second safety feature is we wanted to have a curved straw, because remember, we want baby to come forward. Yes, we don't want them to tilt their head back. So we want them to come forward. That angle of that straw is so important, so that now I can come forward, right? Keep my head forward and slightly tucked. So we have this curvature. And then what happens too with straw drinking, and when I see babies and toddlers doing it, they'll put the straw like this into their tongue, and they'll suckle. We don't want babies to suckle. We want them to suck. Suckling is from birth to 6 months of age. Sucking is older. We want them to suck and swallow. So when they're watch your child if you're using a different straw cup, and then get this one. Because you'll look at the straw and you'll see the baby or the toddler go all the way in. That whole thing's in their mouth. So they're not working on the muscle strength of their lips. They're supposed to have the very tip. Not. So it's so important. Well, how do we teach babies to be able to do that? No one's ever done it. So
sensory bumps, right?
Yes.
Yeah.
The sensory bumps here on the straw. This is going to give, so it's the same sensory bumps that are on the tiny spoon that your babies are used to help them with training. Same sensory bumps on the straw. So that's going to give them the feedback to do this. Now we have 3 safety features. We have a short straw, we have a curved straw, we have the training sensory bumps to be able to help teach your baby how to be able to drink from a cup, from a straw cup. Now, when I'm doing the training, and I have this on my Instagram videos too, but I'll do it really quickly here. But you're going to take, when you're first introducing it, so you buy a straw cup today for that 15% off code. You buy that straw cup, you get it at home. You're going to take this apart. You're going to put breast milk formula again in here, because we're not doing water at 9 months of age, right? And then you're going to take that straw, sensory bumps first, into the cup. You're going to pipe that, and then, get my baby. You're going to give that to your baby. And you're going to do that, dip it in. You're going to do that several times until your baby starts to suck. And you'll hear it because it's a silicone. You're going to hear it. Okay. You hear your baby suck, then, drop your baby, but you offer that breast milk or formula to your baby. And then you'll see them start to suck. And you work on that.
At 9 months you do this?
Yes, at 9 months we do this. And so then you work on that sucking with your baby, and you see your baby just rocking it. Like, right, they're putting their lips onto those sensory bumps. You're doing this for a couple days, maybe a couple weeks, and you're like, my baby's got this down. Like, she knows how to drink from a straw. This is so great. Then the next feature is you take the straw out and you flip it, and now it's the advanced straw. So now we have no curvature. We have no sensory bumps. So we're going to expect baby to still drink from here. If your baby starts to put their whole mouth on here again, then it's too soon. Flip that back over, go back to the training straw. If your baby does do a great job and is able to keep their lips at the tip of the straw, now your child has actually learned how to drink from a straw. You're rocking and rolling. Because here's the thing. If you get a straw cup that is weighted, and I'll use a weighted straw cup with, like, my babies with Down syndrome, my babies with cerebral palsy, because it's really hard for them to drink from a straw cup. But if your baby is neurotypical and growing great, if you use a weighted straw, number one, it collects mold. There's no way to clean that. So it collects mold and cause a whole bunch of health issues. But two, they're really never learning how to drink from a straw. So then when you offer them a drink of water from your straw cup, they'll cough and choke because the weighted straw basically helps keep the liquid up there, so they never learn how to be able to hold their breath. They're never able to practice that. So then they'll take a drink out of your straw cup and they're like, forget this. This hurts. I'm never drinking from a straw cup again. Yeah. And then we can never get them off of a bottle. Yeah. So we want to make sure that we're not using a weighted straw cup. We're using the mini cup of straw training system and make it really easy for you to be able to rock that out.
How long do we, transit from the training straw to the advanced straw?
It's for every child is different, but typically it's a couple of weeks. Okay. Some parents are like, I did it. Your product's amazing. I just did it in a couple of days. And that's great too. But typically it takes a couple of weeks.
Okay.
So
I'll wait to try it.
I know. I can't wait for you too. I got a couple questions here that I want to do. A mom said, what if you're exclusively breastfeeding? So there is a product on my Amazon store. If you go to my bio, there's search my social. There's a product from the Amazon store, or maybe you have something. I'm not sure. But they collect breast milk, so you can put like these little stickies on there and you can collect breast milk. Because remember, we're only putting in like a half an ounce. So if you're leaking, we want it to leak into something, and then you could take that leaking breast milk into this cup, and that's what you use, right? It's going to go in your bra anyways, right? So if you can collect that, you can still exclusively breastfeed and still do this 100%.
Okay. Somebody said this is step 2, and after using the mini cup. No, I think it's a tiny cup first.
Tiny cup first, yep.
And then the mini straw cup. Which you can use it with or without the lid and straw as well.
Yes. Yeah. So what we want to do is we're gonna transition to the straw cup around 9 months of age, but we're not moving to the open cup part of this, because you take all this off and now you have an open cup. We're not doing that till 12 months of age, and here's why. We need to have this. I designed these very differently. This is for, thank you, Tabasco Lover. There's my link to my Amazon store if you want to get something. So this is 2 ounces. This is 4 ounces. This is for the face of a baby. This is for a face of a toddler, because remember, toddlers' faces are growing. If you use this for the baby, it's going to cover their entire face and they're not going to really breathe all that great. So see how this is covering like her whole face? Right? We don't want that. We want to use a tiny cup, and you can see they kind of nest inside of each other, because it's like, this is a bigger face. You see that difference. So we're going to use this, and then we're going to use the straw cup part of this. And then after your baby is 12 months of age, then you're going to start using the open cup part of this. And this is what they're going to be able to learn how to hold too, right? And here's the great thing too. This looks and feels the same. So it's very easy to transition, because a lot of cups, you have, a baby cup and then another cup, and the child is like, nope, I'm going to just have this cup. Exactly. But they look so similar that it's very easy for them to transition. So that's really important to note too. So you can still work on open cup drinking and straw drinking at the same time. Just know the goal. You're working on lip closure or lip rounding. And if you're bottle feeding, we want babies to be off the bottle between 12 and 13 months of age. So they need to master these skills in order to be able to get off of the bottle, because using a bottle or older than 13 months can cause speech issues and feeding issues and all that.
Somebody asked, the baby likes to do sucking gesture, but only 5 months plus. Is it okay to learn from the straw cup or wait till 9 months? I think wait till 9 months, right? Because developmentally
I'd
we should
wait.
follow.
Exactly.
Yeah, but I understand. I know why they feel like this, because straw cup is less mess, right?
Yes. Oh, absolutely. Absolutely. But here's the thing. They can suck. And babies are supposed to, at 5 months of age, they're supposed to start sucking their saliva. So you'll see them do that.
Yeah, swallowing the saliva in.
Right? And that is actually what your baby's trying to do, is figure out how to be able to move that tongue up to the roof of their mouth. And so your baby is showing you, hey, mom, guess what? I'm almost ready to start solids and be able to get that swallow ready. So when babies are suckling from birth to like 6 months of age, they're having that tongue thrust motion that's going out. This is how they suck, right? At 6 months of age, we're expecting that tongue to go up to the roof of the mouth. So if everybody swallows their saliva, feel your tongue in your mouth. Feel how your tongue went up to the roof of your mouth. That's what we expect at 6 months of age. And here's the thing. If we use a sippy cup, we're doing a tongue thrust. Well, when we start solids, remember one of the signs of readiness is decrease of tongue thrust. If we're using a sippy cup, your solids is going to, there's going to be so confused, and it's going to be so messy because they're just going to spit all the food out, right? So,
okay. There's another question. Like, baby is biting the cup instead of drinking the water. So, I guess.
Yeah. So what happens with that? The tiny cup, I designed it to be food grade silicone, and that it's flexible. So what's great is that if your baby starts to bite the tiny cup, then what you do is you flex it.
Then the water goes down, the liquid goes down.
So if they're biting it, you just flex. Oh, now you're working on lip closure again, right? So it's very easy to be able to do that. With other cups, you can't do that. But because it's food grade silicone, we can flex the cup. So that's going to make it easier. Same thing goes if the tongue is underneath the cup. Flex. So it's very easy to transition to be able to help with this.
So it's good, right? They're biting, and then we just
we just need to be able to help, because your baby is basically trying to say, I don't know what to do. I'm going to use my teeth because I don't know how to use my lips appropriately. So we got to strengthen that, right? It's kind of like if you're doing a squat, like, right? You might want to cheat, right? Because you don't want to use those muscles. Well, babies will do the same thing. They'll say, hey, this is much easier for me to bite down on it. We're like, nice try. We need to work on the lips. So we're going to help them do that squat.
It's a pro tip.
It's a pro tip. It's a pro tip. And I know that Instagram is going to kick us off in a couple of minutes. So I didn't get to all the other products, but let's just talk about at least the mini utensils. Just because at least we got through, like, infancy and toddlerhood. So so that is so important. So the reason why I get asked this all the time. The reason why we don't have a fork with our tiny line is because developmentally, babies are not supposed to use a fork. I do everything based on development. There is no developmental milestones that says baby should take a fork, pierce that, and put it into their mouth. It's not. Number one, it's a safety issue. I contract with the Academy of the Blind, the School of the Blind, and most of the early toddlers that are blind because, unfortunately, a caregiver gave them a fork as a baby and they blinded their eye. We do not give babies a fork because of safety reasons, and we do not give babies a fork because it's developmentally. They're not supposed to use a fork. There's tons of products out there that sell baby products with a fork. They're not designed by feeding specialists because that is a huge safety issue. However, developmentally, toddlers are supposed to use a fork. So with our mini utensils, we have a spoon and a fork because developmentally, that's what they're supposed to do. Thank you. And so now we have a fork. But here's the thing. I designed it to have a nylon head because I need to be able to pierce. But see how I'm stabbing myself in my face?
So safe.
It doesn't hurt. So it's very important to be able, because your baby is still teething. If you take this fork and it's sharp, like some of those metal forks out there, and it hits that gum line, your child is not going to want to eat. That can start food refusal and picky eating. We don't want that. We want it to be sharp enough because they are supposed to learn how to pierce. And just like I showed you with the tiny spoon, how you're going to preload a spoon, you're going to preload the fork. So you're going to pierce that piece of watermelon and you're going to set it there on the side of the mat or on the side, or you're going to pierce it and you're going to offer it to your toddler. So you're going to preload the fork just like you did with the spoon, and you're going to continue to offer that. And then you're going to offer the spoon or fork around 12 months of age. So you're going to use a tiny spoon from 6 months to 12 months, and then you can see they look so similar. Again, your child's not going to refuse the spoon. So
the size is also designed with the size of the baby toddler in mind. So
yes,
it's great.
Yes.
Okay.
We have questions here. Thanks for sharing. Start my baby-led journey next month. So excited. I'm doing a free workshop. It's in my bio. It's called What Do I Feed My Baby After Avocado, Banana, and Sweet Potato? And I'm doing another whole hour of teaching on that and a
I'll share it.
whole hour of Q&A. So come join us for that too. So sign
I'll
up.
share it. I'll share it. So I guess maybe Instagram's gonna kick us off soon. So I think maybe for the giveaway, let's do the giveaway now.
Yes, do it.
I guess just tell us why you want to win the Easy Peasy bundle. Just DM me and then I will just choose a winner from there because we don't have enough time. So you get the first food set, the mini set, and the mini straw cup. And any other questions that we didn't answer, just DM and then we'll answer on IGS or
Yes, or we could do this again.
We can do this again maybe. Like because we didn't go through the happy series.
I know.
Yeah. Too short.
It's too short, and I'm a talker. Sorry, but I wanted to answer your guys' questions and tell you a lot of the design features. So it was so great to be here. Thank you so much for inviting me. Thank you everyone for being here. If you like some of the info, please follow me on Instagram. If those of you who are in my community and you like her info, please follow her on Instagram. And really share the love.
Thanks everyone for joining.
Bye-bye.
Bye.